You know, many people with mental health disorders also have co-occurring substance use disorders. This Mental Health Awareness Month in May, Gateway Foundation's Chief Clinical Officer, Jim Scarpace, joined me in studio to share how people can get the help that they need to get through it.
May is Mental Health Awareness Month, and at Gateway Foundation, we really want to help people be aware of the impact mental health and substance use disorders may have on their life and on some of the struggles that they may be experiencing. We know 1 in 5 adults per the Center for Disease Control struggle with a mental health disorder. The most common ones are depression, anxiety, and trauma disorders. And many of the individuals who struggle with these disorders also struggle with what we call a co-occurring mental substance use disorder as well.
Is it more frequent than not that these two exist in the same realm?
Yeah, they're very common, and the reason for that, and this term co-occurring disorders really refers to, two possible ways this can happen to someone. First is you might be struggling with symptoms of depression and anxiety, and they get harder and harder to manage over time, and then you start turning to substances to self-medicate those symptoms, and then before you know it, you have both a mental health disorder and substance use disorder you're struggling with. Another way it can occur is you may have a substance use disorder, and as you continue to use substances, your symptoms of depression and anxiety increase as a result of your substance use, and then you have a substance use and mental health disorder as well.
Oh, wow. So it could be one could start the other at any given point.
Yeah, and at the end of the day, it really isn't as important to determine which one started the other as much as it is to identify it and treat it comprehensively.
How do you treat them concurrently? Can you treat them concurrently?
Yeah. So at Gateway, we have what we call an integrated care model, and that really starts with a thorough assessment evaluation. And first is to reach out and ask for help. And I think because these are behavioral disorders, it's hard sometimes for people to identify, hey, I'm struggling with this. But as you see things get worse and worse over time and more difficult to manage, whether it be mental health symptoms or substance use symptoms, it's important to reach out. Once you're working with us, what we're going to help you do is identify a treatment plan and a recovery plan that's going to work for you. We know the brain has chemicals called neurotransmitters that sometimes get off balance, and that can contribute to both mental health symptoms as well as substance use symptoms. So first, our medical team wants to assess that and determine if medication can help regulate those neurotransmitters, which will help those symptoms that individuals are experiencing be less intense and easier to manage. And then we want to help individuals develop skills to manage the symptoms as their brain is starting to heal, as well as an opportunity to practice those skills. And so we have specialized programs across Gateway that really focus on co-occurring disorders. And what's most important is treating those disorders together and comprehensively, and making sure that the treatment plan really addresses the needs in both areas.
And I would imagine it's really important to be with a professional when you're doing this, because both of them, medically and mentally, could have serious ramifications if you're not watched as you're trying to get better.
Right, and it can feel really overwhelming.
Yeah.
And if you try to do this on your own, without support, it can feel very isolating. And so it's important to reach out and be in a program that can help you identify how these issues, whether it be mental health or substance use, are impacting your day-to-day life, how to help you develop a plan to not only manage them, but to kind of prioritize them and make sure that things can get better over time.
So what's the first step?
First step is to reach out. We have a 24-hour helpline, 877-505-4673 or 877-505-HOPE. Also, our website, gatewayfoundation.org, has a lot of resources to help you better understand what co-occurring disorders are and the comprehensive ways we can treat them.
That's fantastic. Again, May is Mental Health Month, so get the help you need. We appreciate it, Jim. Thank you.
Thank you for having me.
All right, if you or someone you know is struggling with addiction, you can reach out to Gateway Foundation. The number is on your screen, or find them online at gatewayfoundation.org.